While treatment of coronary artery disease has been anatomically driven for a half-century, there is now a question as to whether physiology trumps anatomy as the best course to guide PCI decision-making and clinical outcomes. So what we would like to do is talk about the prognostic value of residual coronary stenosis after functionally complete revascularization, and this is from the JACC April 12th. 2016 issue. And I'm with Dr. William Fearon, who is an MD and professor as well as director of the interventional cardiology department at Stanford University. So this paper is written on behalf of the FAME investigators, correct?
Correct.
Let's start by just reminding us what FAME is.
Yes, so the FAME-1 trial was a study looking at patients with multivessel coronary disease who were eligible for PCI and randomizing them to either fractional flow reserve guided PCI or angio-guided, which was the sort of traditional way of doing PCI at the time of the design of the study. And so operators were asked to identify the lesions that they thought required stenting, and then the patient was randomized. And if randomized to FFR guidance, fractional flow reserve was measured first, and only if it was significant were stents placed. If randomized to angio guidance, then they underwent stenting as per usual routine. And what we found was that the fractional flow reserve guided patients had significantly better outcomes. Although they received fewer stents, the benefit of stenting was optimized by just treating those lesions that were truly causing ischemia, and the lesions that weren't causing ischemia that don't really benefit from stenting and just incur risk of stenting were treated medically.
So in this sub-analysis, what were you looking for specifically?
So, as you mentioned, there's been this interest in complete revascularization, and studies have shown when PCI is guided by angiography that complete revascularization patients do better than with incomplete revascularization. What we were interested in is whether in patients who've undergone functional complete revascularization or PCI guided by FFR, is that residual disease that's left behind that's not significant functionally, is it predictive at all of outcomes? So what we did was calculate what's called the residual syntax score and the syntax revascularization index, two different ways of quantifying the degree of residual disease. The residual syntax score, you basically review the angiogram after the PCI and calculate the amount, or the syntax score essentially, after PCI is completed. And what we found was that in people who've undergone functionally complete revascularization, so all the ischemic lesions were taken care of and the residual disease that's left behind is not causing any ischemia, it's not predictive. So we broke the residual syntax score into quartiles, and whether they had a lot of residual disease or little residual disease, it had no predictive value as far as their outcomes.
So even though now there appears to be more support for complete revascularization, it's complete revascularization, but find out the functional aspect of this rather than just eyeball it.
Right. I think what we're learning is that we really want to optimize the benefit of stenting and minimize the risks. And by using fractional flow reserve, we can identify those lesions that are causing larger degrees of ischemia where a stent's really going to have a great benefit. And we can also identify the lesions that aren't causing ischemia, where medical therapy does quite well, and stents continue to have a small risk, and that risk outweighs any benefit. And so we can, again, more judiciously revascularize the patients.
Do you think this is essentially the approach where we're going for the next few years?
I think so. I think, one of the limitations of this study is that it's retrospective, and so we're now doing what's called the FAME-3 trial, where we're prospectively looking at this strategy and randomizing patients to FFR-guided PCI with multivessel disease versus bypass. And I think the data from that will be very informative regarding whether this is the approach that we should be taking in all of our patients.
So at least as of now, the FAME data support functionally complete rather than angiographically complete revascularization.
Yes.
And this is all in the April 12th issue of JACC 2016. Please look for the paper by Dr. Fearon et al. And the accompanying editorial comment. For CardioSource World News, I'm Executive Editor Rick McGuire.